Drug companies are hoping to capitalize on the fact that the consumption of certain plants appears to lower the risk of diabetes by isolating the active components for use and sale as pharmacological agents. Though not as profitable, why not just eat the plants? One plant in particular that's now been tested is flax. We've known for 20 years that having ground flax seeds in your stomach can blunt the blood sugar spike from a meal, but it's never been tested in diabetics until now. An open-label study on the effect of flaxseed powder supplementation in the management of diabetes. A tablespoon of ground flax seeds every day for a month, and, compared to the control group, a significant drop in a day to their diets for 3 months. In fact, the flax group and fasting blood sugars, triglycerides, and cholesterol, a drop in A1C level. This was just after a month. Though if one's sugars are already well controlled, though there may be no additional benefit. No weight gain was reported in people adding a quarter cup of ground flax, ended up with a slimmer waist than the flaxseed oil or control group, even up to nearly no significant weight gain, though this was only after a month. How does flax help control diabetes? Well, flaxseed consumption may improve insulin sensitivity in people with glucose intolerance. There's a small but significant drop in insulin resistance, perhaps related to the drop in oxidant stress, given the antioxidant qualities of flaxseed phytonutrients. Now, this was a small, unblinded study. It's hard to a half cup a day, more than I'd recommend, still not come up with a convincing fake flaxseed placebo. So look, if this was some drug they were testing, I'd never prescribe it based on this one study, but it isn't a drug, it's just flax seeds. There's just good side effects. So even if this flax seeds have other benefits, so even in the worst case scenario, I'd still end up benefiting my patients, not quite ready or able to reverse their diabetes completely with a completely plant-based